Hello, everyone. My name is Imani Combs. I would like to welcome you to my presentation on Dr. F. Charles Mace. First, let me introduce you to the man who is Dr. F. Charles Mace, or Bud Mace. He is a licensed psychologist and decorated contributor to the field of behavioral analysis. He has focused on the functional analysis of rigid behavior. In addition, he has also focused on matching law and behavioral momentum. One of the prestigious awards that he has been granted is the American Psychological Association's John F. Hake Award for Outstanding Basic Research and its Applications. He has been active from the late 1980s to the early 2010s, with a career spanning over 30 years. Dr. Mace received his PhD from the University of Arizona in 1983. He has held past positions as the editor of translational research at the Journal of Experimental Analysis of Behavior, editor-in-chief of the Journal of Applied Behavioral Analysis, president of the Society of Experimental Analysis of Behavior, and past faculty positions at prestigious universities such as Rutgers University in Washington, D.C., University of Wales in the United Kingdom, and University of Southern Maine, which is his most recent position, although Dr. Mace is now retired. He is also highly cited, having published over 100 articles. He is also rated high amongst productivity for behavioral analysts. In addition, his work has focused on functional analysis of severe behavioral disorders, as I mentioned earlier in this presentation. I will be focusing on functional analysis throughout his literature. First, let's define functional analysis in terms of applied behavioral analysis. It is a methodology for classifying behaviors according to the contingencies that maintain them under well-defined conditions. I will be analyzing the following articles. I have found self-injurious behavior to be a common theme in Dr. Mace's literature, as well as bizarre speech. I will also be reviewing a literature review that talks about the importance of functional analysis in applied behavioral analysis. Mace and Milk, 1995, used functional analysis to classify self-injurious behavior as either biological operant-based or mixed operant and biological. The study found that by creating a model that classifies self-injurious behavior based on the contingencies that maintain it, we can develop a targeted intervention that can lower the rate of failed treatment. In addition, Mace and colleagues 2001 used functional analysis to determine whether or not self-injurious behavior maintained by environmental contingencies would respond better to operant treatments or antipsychotic treatments. Subjects were 15 subjects who were admitted for treatment of self-injurious behavior. They were evaluated under conditions such as attention, tangible reinforcement, escape from task, alone, control condition of attention, tangible reinforcers, and no task demands. And what they found was that 80% of subjects improved under environmental contingencies, which has proven to us that if self-injurious behavior is maintained by environmental contingencies, operant treatment is the way to go. In a study of a 46-year-old male with moderate mental retardation who exhibited bizarre speech and had symptoms including self-talk, off-topic statements, bizarre comments accompanied by body movements, we found in experimental analysis that bizarre speech to be an attention-producing behavior. A functional analysis later revealed that by selecting between two equivalent treatments, we could better treat the bizarre speech exhibited by the patient. Good treatments included non-contingent schedule of attention and social and language skills. Overall, both treatments were effective in reducing bizarre speech. In a study by Mace and colleagues, 1988, a functional analysis was used to determine whether or not there was a relationship between bizarre speech and environmental contingencies in a 29-year-old woman with mild mental retardation and schizophrenia. Results found that less frequent instances of bizarre speech appeared during one-on-one interaction with attention contingent upon appropriate vocalization, as opposed to demand conditions. Pre-intervention assessment led to a minimally intrusive intervention that gave generality. As a behavioral analysis, we know that it is important for our work to be journalizable, meaning that it can apply to different subjects in a variety of environments. Mace 1994, which was a literature review, found that behaviors are developed by individuals through interactions with the environment. Each individual has a history that determines their response to treatment, and functional analysis can reveal links between responses and contingencies. This has revolutionized our approach to the treatment of bizarre behaviors such as self-injurious behavior and bizarre speech. Overall, it has increased confidence in the perceived effectiveness of treatment. Mace went on to state that this has renewed our analytic spirit. Why is Dr. F. Charles Mace important to the field? Well, let's review a bit. He has created improvements in the identification of effective treatments. Behavioral analysis is a field that thrives off creating interventions that work in the benefit of our patients. He has created positive change in the lives of patients through his work. In addition, he has also created positive change in the lives of their families. Overall, Dr. Mace's work has embodied the goals of ABA through his dedication to the treatment of socially significant behaviors, which is our overall driving purpose. I hope that you have learned a lot about Dr. Mace, including his life, his career, his past positions, his research work, and how he has used functional analysis in his studies. Here are the references for the materials I used or the resources I used to create this presentation. I hope you enjoyed.